We turn now to Florida, where Governor Ron DeSantis signed a law banning abortions after 6 weeks late last night. Dr. Shelly Tien is an abortion care provider with Planned Parenthood of South, East, and North Florida. She joins me now to take a look at what this means for women in Florida and across the South. Dr. Tien, thanks for taking the time. As news spread of this law today, what are you hearing from your patients?
Yeah, thank you for having me. I appreciate it. So yeah, this 6-week ban is truly devastating. It essentially robs patients and their families from being able to make a fundamental healthcare decision for their bodies.
Our Rachel Scott spoke with the bill's sponsor. Let's take a listen to some of what she said.
The women who choose life, who stay in Florida, they are going to be supported, and we are going to wrap around services to make sure that that life is protected and that we are holding up those families if they have a need.
All right, having said that, for the patients you serve, what's the reality there in terms of support and services?
Yeah, so I think it's very important that the public realizes the the profound impacts and amplitude of this ban. So first and foremost, of course, this ban impacts women who are pregnant, that don't want to be pregnant, that are seeking safe and compassionate abortion care. It also impacts women who have desired pregnancies that develop pregnancy complications throughout the course of their pregnancies. And complications can occur for a multitude of maternal and fetal reasons, where sometimes the safest option for families is to end the pregnancy. And thirdly, this ban impacts any healthcare provider, physicians, nurses, clinical staff that care for pregnant women. Safe abortion care is a part of women's health care, and providing 7 scientific, evidence-based counseling on contraception and abortion and provision of those services is an important and necessary part of our care. I understand that this ban has very narrow exceptions for maternal life and maternal disability, but the reality is that there are many complex and nuanced health conditions that can develop in any pregnancy that don't fit these narrow exceptions. And it really puts physicians in an impossible position where they may feel that they have to delay or even withhold care for fear that their interventions will be misinterpreted in a court of law.
And doctor, for your patients in Florida and really from surrounding states, what does this law mean for their abortion care options?
So certainly it's another tremendous barrier. So we care for, I'm in Northern Florida and I care for patients in Northern Florida, but also the entire state of Florida. And because of restrictions in neighboring states, we care for patients in multitude of other states: Texas, Oklahoma, Alabama, Louisiana, Mississippi. And so, these patients are already traveling hundreds of miles desperately seeking care, and they won't have that option anymore.
All right, Dr. Shelly Tien, thank you so much. This is obviously something we're going to continue to follow you as well, I would assume. We appreciate you taking the time.
Oh, great. Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.